We are still waiting on our last panelist, but I think we're going to get started. My name is Elisa Crossman. I'm one of the undergrad advisors in the Herbert Wertheim School of Public Health. Tonight, we'll be hearing from a panel of 4 current and just graduated graduate students in a variety of public health related programs. I want to encourage you to use their answers as a starting point for your journey into researching the graduate programs and career paths that are the best fit for you. For more information about graduate school, visit the public health website. You can start researching graduate programs at the Planning Your Future tab at ph.ucsd.edu/undergrad. Our panelist information and contacts can also be found on our website. I do want to remind you that today's event will be recorded and will eventually be available on the public health website and YouTube following the event. Our last panelist has joined us, and I'm so excited. I would like to ask all of our panelists to please introduce themselves. We will get started. I'm going to stop sharing real quick, and we'll get started with Cassidy. Can you please introduce yourself? Let us know a little bit about you and the program that you graduated from.
Hi everyone, I'm Cassidy. I graduated in 2022 with a double Bachelor's of Science in Ecology, Behavior, and Evolution and Public Health with the EPI concentration. I continued on for an extra year to participate in the Biology BS-MS program, and then from there I moved across the country and attended Boston University School of Public Health. And I just graduated last May, and I studied epidemiology and biostatistics, and just enjoying post-grad life, waiting for my job to start.
Great. Awesome. Brandon, could you also introduce yourself, please?
Aloha kako, everybody. My name is Brandon. Uh, I graduated from the public health program here at UC San Diego in 2023 with a Bachelor's of Science in Public Health, concentration in epidemiology. And immediately after, I attended the University of Hawaii at Manoa, where I graduated with my Master's in Public Health and Epidemiology in May of 2025. I'm currently working as the environmental health researcher on the Thompson School Registry Hub as part of the Red Hill Registry, as you can see from my background here. Yeah. So it's nice to meet you all.
Fantastic. Stephanie, could you introduce yourself?
Hi everyone, I'm Stephanie Micucci. I graduated from UCSD in the public health program actually in 2019. And then I got my MPH from George Washington University in Washington, D.C. In 2022. And I did that in global health epidemiology. And then for the past few years, I've been working at Walter Reed Military Medical Center doing military research in cancer and then also in women's health. So that's what I've been up to since I graduated.
Excellent. And last but not least, Nayeli, could you introduce yourself?
Yes. Hi, everyone. My name is Nayeli. I graduated from UCSD in 2024. Wait, is that right? Yes. I forget. I was actually in the global health program or global health major. I am now currently in my MPH program. I'm a second year at Columbia University, Mailman School of Public Health. And I'm in the Department of Family and Population Health with a certificate in climate and health. So we'll be graduating this upcoming spring. That's why I'm lost on time because I'm like, what, where are we? But yeah, that's a little bit about
Exciting
me.
though. Almost there.
Yes.
Nayeli, why don't we get started? And I'm sorry, I feel like I'm mispronouncing your name. Can you say it one more time?
Yeah, Nayeli.
Nayeli. Okay.
Yeah.
Can you possibly tell us, can you get started with the panel? Can you tell us why you chose your career path? Sort of what drew you to this field? Why do you feel passionately about it? And whether your perspective maybe changed over time. If you previously had considered any other career paths, how you made the decision, etc.
Yeah. So I actually Um, I was a transfer, so go transfers. I started off in community college. I was pre-med at the time. Um, I think was just trying to figure it out. Everybody was kind of in the pre-med world. And then after that, I started doing a little bit more research and I saw public health as an option. Um, I think I just liked the description that it was kind of aiming at. I was a little bit more social justice oriented at the time as well. Still am, and then but didn't have much knowledge on it. And then I think somebody had recommended, I was in a pre-med club, they had mentioned, oh, why don't you consider research as well? And from there, things kind of pivoted. Kind of was in the PhD bound. That changed. But it ultimately led me to being in a lab in a public health setting. And then I transferred to UCSD. I saw the global health program. I was really fascinated with just beyond the borders and doing research. So now here at Columbia, I'm still very public health oriented, but I'm now heading towards the environmental health sciences route, which I've kind of feel like I finally found something that within the public health setting that I'm passionate about. Took some time, but yeah, I guess to answer that question about possible career paths, I went through pre-med, PhD bound, and then now um, in the research setting. So I think for now, I'm gonna stick to that and seeing where I land in the job role. But definitely, I'm considering research still.
It's always so interesting to hear from panelists, sort of twists and turns. I
Hmm.
think it's really common for our students to be worried that they don't have it all figured out as
Right,
undergrads. So it's great
right.
to hear that.
Yeah, and I think I ask PIs and people in labs all the time, like, how did you end up there? And their question is like, yeah, I don't even know. I just one path led me to another, and now I'm here. So I think I can see why it's anxiety inducing to figure
Mhm.
out which one you want to do, but I think ultimately it will land you there. It just takes some time.
Thank you. Now, I think, Brandon, you also are doing something environmental related. Am I correct?
Yes, somewhat. My title may be that, but I actually deal a lot more with questionnaire development and survey development, which is
Hmm.
why I forgot to mention that in my introduction. But yeah.
Can you maybe share with us how you chose your career path in public health and sort of if you had an evolution, if it
Oh.
changed over perspective changed over time, etc.?
Yeah, sure. So when I first joined UC San Diego in 2020, it was in the middle of COVID, so all my classes were, in Zoom. Uh, I actually came in as a microbiology major intending to go pre-med, but after some advice from my counselor, I think it was you actually, Elisa, we had a meeting because I took FMPH 40 after the advice of you and also my microbiology advisor. I took it and I was like, oh, this is like really, really interesting. Yeah, I want to learn more. I immediately hopped ship. Also because I was fortunate enough in my high school, I did a extracurricular called Science Olympiad. I don't know if any of you are familiar with it. Basically, it's just like extracurricular that you can do all different types of like scientific events from like anatomy and physiology, towers for engineering, bridges if you're also building with physics. I did something called disease detectives, which was very much epidemiology based. But at the time, I didn't know what that was, and I never knew that public health was a field you could actually go into. It took me going to public health to realize, oh, I want to do public health. And then as I took more classes, I figured out, oh, I want to specialize in epidemiology.
I love it. That's awesome. Cassidy, can you maybe share with us about your career path?
Yeah, okay. So my career path changed a lot. When I came into UCSD in 2018, I was a bioinformatics major. Um, and I wanted to do a lot of coding and be behind a desk. And then I was taking the classes and I realized taking the computer science classes, kind of realized the passion wasn't there. Like I enjoyed the challenge, but that's not what I wanted to do long term. And I shopped around the different bio majors because I knew I liked science. I thought about doing like a psychology major, or no, psychology minor or a math minor, just because I really liked the why behind science. Some sorority sisters were studying public health, and I had thought about it, but because I was in bio, if I didn't like public health, I didn't want to lose my chance. I didn't want to have to reapply into the bio major.
Mm-hmm.
Um, so uh I decided I was going to minor in global health because couldn't I at the I don't know if it's changed now, but um back at the time like you couldn't minor in public health, only global health.
Still correct.
Um,
Yeah.
yeah, so pandemic rolls around. I'm sitting at my desk realizing that I've taken so many classes, I could actually fit in a public health double major.
Mm-hmm.
So then I was trying to figure out what I wanted to specialize in, and because I had that bio background, I do still really enjoy science. I thought, oh, epidemiology is perfect. I don't need like my electives for for public health overlap with bio. This is perfect. And it was really interesting to just see the why um, of biology and how it contributes to society. I also knew for a while, I was into bio, but I didn't know what I wanted to do with my career because I knew like I admire people who go through med school, but for me, that's just something I knew I didn't want. I really liked kind of the backseat doing working with the community rather than one person, just because like everybody, it's so specific to what everybody needs, but there are certain behaviors that impact everyone negatively or positively. So yeah, I took some classes, really found that I liked public health, and I decided after I got my master's in bio, I wanted to do more school, which is not surprising to me at all. And I went in totally thinking I wanted to work in the government. I wasn't sure if I wanted to go back to research. And I had an internship with Oak Ridge Institute of Science and Education, working at CDC for 8 months, and that was really eye-opening. One of my dreams was to work for CDC, so even though it was for 8 weeks, I was like, if this is my chance, I cannot pass this up. And I would love to go back at some point, and then I I was moving my career path maybe towards government, but also for my practicum, for my grad program, I was a hepatitis C caseworker. So I would call uh, LA County residents who had tested positive for hepatitis C and tell them they had hepatitis C and then link them to treatment if they hadn't been treated. And that's where my love of clinical research started. When I started my job search, again, I wasn't so sure I wanted to do research. I was really looking for these government positions, and I had an interview for a clinical research position. And I thought, okay, why not? Like, I want to open up my mind to up to a bunch of different career options. And the way that the person interviewing me was describing how like how collaborative the public health environment was, even if it was the researcher to the participant of the study, I just like something clicked I I was still like applying to all types of public health jobs, but I'm really happy that I am going to be working in a research position. And while I'm waiting for the VA paperwork to be processed, I've gone back to my practicum site. This time I'm doing something a little bit different, but there's something that really useful about clinical research that I feel like it's very discouraging because like nobody sees what the research coordinators are doing behind the scenes, but when the study works, it's really rewarding. And so my career path definitely has changed, and I'm really happy that I stayed in public health. I thought I was done with school. I wasn't going to get a PhD. And then my last semester, I was in a class with a bunch of PhD students, and I do think I want to go back to school to get a PhD. I just need to work because I was in school for a really long time, and I think I've realized also like right now, like public health needs a lot of work and support, and it is really discouraging to see what's going on in or with public health, but at the same time, I feel like that makes me want to fight harder. And I can complain about it with my peers, but still doing research or working in the government, it's helpful. It's not it's we can't give up because public health is so important to the general well-being of everyone. Um, yeah, so just being able to work in a research space, I know I'm gonna be doing good.
you. That's awesome. Um, and just so anybody who is a current student isn't super confused, it used to be that it was much more difficult to be a biology major, and it was extremely impacted. And now it's actually not impacted, and we are the more difficult major to be. So believe it or not. All right, Stephanie, could you tell us a little bit about how you chose your career path, how your perspective changed over time, any other career paths that you considered, et cetera?
Yeah, I think it's so interesting because even hearing the other three panelists talk and then just in people I've met on my journey, so many people start off in this other space or realm and then they transfer into public health because they realize how cool it is. But I think I got kind of lucky with, I came into college as a public health major. Someone in high school that, I was close friends with was also, in the same kind of had the same interest that I did. She was like, "Oh, I heard about this public health major, you should check it out." And I was like, "Oh, that's really cool." So, I was looking at colleges that had public health. So I feel like I would kind of had my foot in the door almost as to what I wanted to do. And then, as I started taking the classes in college, I was like, "Oh, I, definitely really like this." I wanted to do, health and medicine, but I knew I didn't want to do pre-med. So thankfully I didn't have to take OChem and that kind of thing. Like probably some of you guys had to do. Um, but yeah, then at some point during college, I needed to get a job and pay rent. And I was like, I would love to be able to do an internship type of thing instead of, I did work at Ralph's for a little bit. I do not recommend, but you do what you got to do. But so I did find an internship and she was willing to pay me. It's Dr. Larson, if anyone has interacted with her before at UCSD, but she, put me on one of her studies, like a research assistant, and then I ended up working with her through graduation and, after I left. So I got that research experience kind of up front. And I realized, public health is definitely my field. Research is definitely the thing that I want to do. So I think I've kind of just been in the right place at the right time. And with hindsight, my path looks pretty straight. And I did a lot of research in my master's program, and that was something that I was really looking for too. But I will say that, every step of the way there was second guessing and should I change it? Should I do something else? What are all of my options and all of this stuff? So it's definitely very common to switch in and out of things. So I think I'm kind of lucky that I found early on the path that I wanted to take. I just submitted PhD applications, so hopefully that is the next step. December 1st was like the big date, so I'm a much happier person today on the second. Everything's in. But yeah, I think that's kind of how I got into this, and I've just kind of stayed straight on my public health research path, which I'm really grateful for. But yeah, I kind of just knew early on this was what I wanted to do.
Not to put you on the spot, I'm sorry, but since you just mentioned about applying for PhD programs, could you possibly share a little bit about maybe how different it was to apply for a PhD program versus a master's? Or
Totally,
maybe like
yes.
what it felt like?
Yeah, so I think also my experience with the PhD program is a little bit different than most people's, where I only applied to the joint doctoral program at UCSD and SDSU. So I'm really hoping I get in, but I think most people are applying to multiple programs. I just, at this stage in my life, I think I'm a few years older than some of the other panelists. Like, I know that I want to come back to San Diego. I'm in Washington, D.C. now. I've had a bunch of work experience, so I've really narrowed down like this is the place I want to be and this is what I want to do. So with that though, the application process I would say is much more specific to the schools you're looking at. So, I did a lot of talking to different faculty members at UCSD and SDSU, and I didn't really do that when I was applying to my master's. I'd say it's much more competitive, certainly. I think at GW we had a class of, sorry, my phone is going off, like 200, and they take a handful of people at each school for PhDs. So, in that sense, it's different. You really have to go in with a pretty set idea of what you want to do. With my master's, I knew that I wanted to do kind of an epidemiology related thing, and that was all I knew, and that was fine to go into it. But, whereas this, it's like you have to think about what very specific area of research do I want to work in? Is the faculty at that school available and willing to take a student? So it's just much more specific. I would say like the essays and all of that were the same kind of deal. But yeah, you have to go in a lot more focused, I'd say.
Thank you for being
Yeah.
willing to be put on the spot there
No,
for
it's
that
no problem.
question. They'll give you a little break here so that you can catch your breath, get some water. I guess for the next question, maybe let's start with Brandon. Can you tell us what experiences you had as an undergrad that you found to be most beneficial in your grad career?
Sure, but one last thing just to add on to Stephanie's point, because I'm actually applying for my PhD right now as
So
well.
sorry, you can actually, yes,
The
please add
funny,
on.
which is really funny story, because my application was due yesterday, so
Mhm.
I literally just turned it in.
Yes.
And mine, I did the same thing as you, Stephanie, but I only applied to one school. I only applied to the University of Hawaii at Manoa. And fortunately, in my position, because I'm still employed by the university, I actually was able to talk to all the faculty, and I work with a lot of the faculty in a professional setting. So I was actually able to talk to a lot of them, get advice about, okay, what are my options? Especially since I'm employed by the university, trying to work out, can I work full time? Can I work part time? How does that work out? So those are also things you might want to think about. And I agree, I definitely agree on the essay. For the essay, you have to be very specific about what you want to do. Like instead of like my master's essay was a little bit all over the place. I kind of go about my entire history of what like my my experience in public health. While for my PhD, I wrote about my time and my position here in my job. And I wrote about, oh, I want to do this type of data set to look at this thing, and if this is not available, then I would use this data set, being very specific about, hey, if things don't work out, I have alternatives. This is what I want to research in. And I agree, you do have to do a lot more research into the faculty, making sure that, oh, hey, you have faculty that can actually support you throughout your project as well. As for the question about experiences in undergraduate, I was a part of the public health undergrad organization during my time here, uh, which was very, very helpful as I was able to speak to a lot of the master students. I don't know if any of them know like Eric. I forget his last name. He might have just been like in Oregon, but he was a he was an undergrad a couple years older than me, and he gave me a lot of advice about like applying for like masters, and especially since how to write a resume because I did not know how to write a resume at the time, and especially a
Sounds like
CV.
something we maybe need to work on with our undergrads, huh?
Yeah, yeah, and CVs, especially since I had to turn in a CV for my PhD program and masters as well. But I found those type of experiences outside the classroom with like more professional development to be the most essential.
Really helpful. Cassidy, I know that you mentioned you something in the chat as well that I think Eric
Eric
name.
Long.
Mhm.
He was my year. We like we had some classes together and I remember he was we worked we were in a homework group for FMPH 102 and
Mhm.
it was g- it was so great working with him both in class and also I was also in the public health undergraduate organization. uh my first year I would just go to meetings and then my second year because I switched to public health my third year. um I was on the board with Brandon actually. So that was a great way just to interact with people. That's also actually kind of how I ended up applying to BU because I remember there was a panel and I was for current MPH students and I was trying to figure out, okay, where's everybody applying? What are the best grad programs I can apply like for public health because I don't know Eric I think is in PA school. Um but yeah, I somebody talked about BU like other schools were on the list and I had probably like narrowing down my list was hard because like I was kind of going off word of mouth of what the panelists were saying. In BU, I just really liked their program. I can get into that later, but it was because of that panel and virtually interacting with UCSD alum about their experiences. I think that helped me a lot, especially because like I am born and raised on the West Coast in Southern California. So knowing that people who are in the same boat could like move across the country and figure out what they're doing with their career was pretty great. Definitely like
That's
the
exciting.
classes.
It's exciting that you're part of a panel now.
Yeah,
You've got the other side of it.
this is my second panel I'm doing, I think through the UCSD Public Health Department. Um, so yeah, the and also like a lot of the classes that I took, they helped me just within the classroom as well. Like one of my classes, we very briefly went over occupational and environmental health, and I was telling all my friends, like, oh yeah, I took a whole 10-week class on this. So I was not confused in class at all, very bare bone. Um, of what those 10 weeks were. Also, the health policy and law class that I think going into a master's program for public health, everybody does need to take as a core class because there was a whole class on the US healthcare system. That really helped me with the second half of that class because that was going over like Medicare, Medicaid, Medi-Cal, all of like I think the mass health is the equivalent. So just like the even like the classes I feel like in the for undergrad, I feel like that really helped me with my master's because like I kind of knew how to use R already. SPSS, like it's similar enough. Just a lot of skills going in. Even some of the bio classes I took that were related to infectious disease, like that gave me a leg up because when we were doing or when we were learning about the disease models, this wasn't something completely new to me. Um, and like definitely once the classes got smaller, in the public and for the public health, like talking to my professors, just like a lot of kind of what Brandon was saying of inside and outside. But I think like what I felt like very reassured was again like having these undergraduate classes that a lot of like especially people going in that were like chemistry, history, bio, they didn't have all of these resources, and I wasn't completely lost, which is really hard to do, or which it's really hard to not feel lost in grad school.
Thank you. Nayeli, could you tell us about your experiences as an undergrad that you found to be most beneficial in your grad career?
Yeah, I think for me it was research. I don't remember exactly how I found this position, but since I was a transfer and I 2 years, I worked with a um, doctor at the Rady Children's Hospital. Um, oh yeah, I think it was through what's that app where you are able to find jobs?
The Real Portal or Handshake?
Handshake, yeah. So I found mine prior to transferring and worked with her for those 2 years on that study, which was more community health science, doing research with her. She's amazing. And yeah, I think through that, I was signed up with like some of the public health organizations just to see what they were doing. Um, but ultimately, that research experience kind of did help me a lot, being involved in research. I also was a part of the, I think, forget what it's called, the Mexican Migration Fieldwork
Oh,
Research Program, F
mm-hmm.
FMRP, something like that.
Yeah, I
Um,
think it's called something different now, but I think it's through Global Health, right?
yes, yeah, with the, yeah, forgot her name as well. I think something Professor Andrews, not sure, but yeah, that was doing work, research work, at the border in Tijuana, which I was a really good experience. So yeah, all those research experiences kind of led me and prepared me for the research that I'm doing now in my grad program. Um, just really good experiences that once you start to see how different labs work and what you experience there and how you can apply it or learn different skills. But yeah, that was kind of my experience at UCSD with research. Not so much clubs, but hearing about
That
it and seeing who's involved.
that's okay. Everybody's experience is different, right? And so what you found beneficial isn't necessarily what everybody else did, but it's really helpful for students to hear about all the different things that were beneficial. So that's great. All right. How about Stephanie? Could you tell us maybe I know you started to talk about it a little bit, but could you tell us a little bit about how graduate school is different from being an undergrad?
Sure. I will say, I think the first thing I noticed was that there's so much reading, which I mean, undergraduate had a lot, but it was like kind of shocking when you get there and they're like, here's all of this reading that you have to do. It was like, oh my gosh. So there's a lot of, I think, external work, but in the same vein, at least for my program, it was you kind of got what you put in, right? So it's not necessarily going to be as many exams as I experienced in undergraduate. A lot of it is like papers that you're turning in or presentations. You're not necessarily being directly tested on material. And a lot of it was, how you're going to apply it, which I mean, again, that was just my program at GW, but I think it was more of like a real world experience where, and you're not going to be tested necessarily in the real world, but you have to know how to take this knowledge that you've just learned and actually apply it to what you're doing. Um, so, with that, some of the homework wasn't necessarily graded or anything, so you could get away with not doing it, which I found, less in undergrad, but the people that took advantage of that definitely did not do well later on. And so I would say it's so much more personal accountability of showing up to class. Part of my graduate school was also on Zoom, so I think it was easier to, not turn on your computer or like leave your computer when your camera's off, than like the accountability of being in class. So I think it's a lot more, you're in charge of yourself and you're managing yourself way more than I think my experience was in undergrad. And also, it's really what you're putting into it that you're going to get out of it more so.
Love that. I love that. Brandon, is there anything that you could add about the difference?
Sure. So I just added in the chat. I forgot to mention about the honors practical. It's where I learned how to do a lot of the questionnaire and like survey design. I
Mm-hmm.
just thought I would mention that for those of you who are in or who are going to be in the honors practicum. I know it was changed from a year-long course to a two-semester, 6 credit course. I do remember that. Um, but as to the differences between the two, all of my classes were in person, and they still stress the importance of attendance. And I completely agree that there's so much reading to be done. But for those, the other thing I recognize that was much different is just the age group of people in my master's cohort. Like I was probably the youngest person in my cohort, and there was a lot of people who were maybe doctors or already had a master's in something else coming back into public health from another field because they're interested in like the community aspect or they want to learn more about public health. So there really is a wide range of experiences that I think you should try to learn from and take advantage of, especially in group projects, because there may be some ideas that in like one of the group projects we had to do is we had to uh it was like program development, and ours was tackling bird flu last year when bird flu was a major concern. And we had two people in epi and two people who were not with a public health background. And just seeing the fusion of ideas, I think made our project really, really strong.
I love that. That's awesome. Cassidy, could you tell us a little bit about how grad school is different from being an undergrad?
Yeah, so going off of what Brandon was saying about the age group, I think the average incoming age was 25, so it would have been 27 by the time I graduated. And like I befriended people fresh out of undergrad, so like 22 to people who were like 28. Um, and I was still like on the younger side. Yeah, there were people in their 30s who were like doctors from like India who wanted to get their MPH. Uh, and there was just a very big crowd, different, everybody came from different background, even like majors, like people I was friends with somebody that was a history major. I was friends with a lot of chemistry majors. I was friends with somebody that I was friends with people who were public health majors. Um just like anthropology, like so much of I think that also really shows how interdisciplinary public health is, that you can take any major and you can find somebody in an MPH program because it will you can find a way to make anything public health. Um, Also, uh, BU is on the semester system, and after being on the quarter system for 5 years, I happen to befriend a lot of people who are also on the quarter system, so we all are like, oh, this is going to be my first time on the semester system. I don't know what this is going to be like. Um, and I know you see it, or like it is kind of a unique experience, but like so that was something that I was thinking about going in. And the 15 weeks do feel long. I think each has their merit, like each has their strengths, but like I don't know. I might actually like quarter more because I'm so used to it, but like I didn't dislike the semester system. Um Also, like the classes, and also this is comparing it to my MS in bio. It was a lot of lab research, not so much classes, where this was very much was a class based master's program. Um, so like yeah, classes were once a week, but they were 3 hours at once. And I had a hard time with that because that's a lot of hours for class. Um, but it did give a lot of opportunities for discussion in my coding classes actually. Once you got past the core class that everybody had to take, there was only instruction for about an hour to an hour and a half, and the rest was lab time. So we got to do our homework. We could ask our professor questions. I made a lot of study groups with my friends, so we would just all start talking to each other, figuring out, okay, how are we, let's finish this homework. And about half the time, I was already done with my homework by the time I left class. So, like some of the assignments were time consuming, especially with the reading, but because I did epi and biostats, I didn't have as much of the reading. That was just my preference. And yeah, so that like yeah, the also like having a ton of free time, it's strange because you feel that in undergrad, but the classes tend to be multiple times a week. But in grad school, again, it could be different at every program, but at least at BU, every class, it was just, yeah, it was once a week. So I was probably on campus 2 to 3 times a week, and otherwise I was at home doing homework. Sometimes I would go to the library. I would need to figure out how to create time to make sure I'm getting work done, but also stay productive. And for some people that was working, that was for some people it was just really making sure they spent time doing their homework like me, or like finding hobbies outside of class. Like there are a lot of ways you can fill your time in grad school, and you think, "Oh, I'm going to be so busy in grad school." You're busy, but you're also not. The same way the classes are, they're easier, but they're also harder, but it's in different ways, and it's the hardest quarter of grad or semester of grad school is your first, because suddenly your schedule is completely different and you have to figure out how you're going to balance your time, how to sit through that 3 hour class, uh, and yeah, figure out reading how to change your time management skills. Um, for me, my procrastination actually got worse as the years went on, but I think that was the senioritis, but I still got everything done. But at the beginning, I was like, okay, I gotta get this done right away because if not, I'm just not gonna worry about it later. But then sometimes it turned out waiting until the last minute, or not maybe the last minute, but waiting towards like the end of my week to do something was better for my brain. Like it really just depended. And yeah, that first semester is so hard just because you're figuring out how to change your lifestyle.
Thank you. Nayeli, could you tell us a little bit about how grad school is different than being an undergrad?
Yeah, I think with everyone else, what they've been saying. In terms of time, because I did 2 years at UCSD and now 2 years is flying by at this program, I've felt that to be the same. However, I've had experience with both semester and quarter. So that wasn't like too, I guess going from quarter to then semester again, um, you're like, wow, I feel like I have so much time. But yeah, we here at Columbia, we have a lot of class-based discussions. So it's being prepared with those readings and contributing to those class discussions. And sometimes it's kind of like the movies, they really do pick on you and you kind of have to be ready. Um, I did notice my first year we had more, instead of these 10-page papers, it was 1 to 2 pages. So they want to see how clear and concise you can be. That was probably the biggest change that I noticed from UCSD, where we're writing like 8-page papers. So then now, clear and concise, give your ideas. And that's what I noticed was a big shift. It's interesting because I feel like this year we've had more assignments throughout the program. Um, every 2 weeks we have assignments. We also have exams, more class presentations than I did at UCSD, because they want to see how you can, talk like a scientist or present data, which is good experience, that I didn't have at UCSD as much. But yeah, I feel like those are some major differences that I've noticed. Classes tend to get smaller. as you're getting more focused in your certificate or concentration, depending on each program. Um, Meaning you have to contribute to the classroom settings where at UCSD, when you're in lecture halls of like 50 to 100, you can get away with not saying much. So yeah, I think that really is kind of a big difference in from undergrad to graduate school.
Too. Um, Now I know our our participants always have a lot of questions about what it's like to apply, how you what resources you use to find to fill out applications. Um, can you give us just a real concise best advice um, for searching for graduate programs, how to find the right grad program for you, and how to prepare for applications? Maybe like 2 or 3 sentences.
Do you want me to start?
Oh yeah,
Oh, yeah.
sorry.
Definitely, I think location really matters. Um, I think that really searching the program departments and the people who are there, what research they're doing, if that's something of your interest, um, the classes that they offer, and kind of, I also like to see alumni and what they're doing. I think that's a huge one, but definitely location and the environment. Do you see yourself being around there? Because it's going to be 2 years, which go by really fast. But also, I think from my experience, I enjoyed New York City, but I'm originally from LA, so I think having that distance can be a little bit difficult if you don't have family around you. So that's something to consider if you can see yourself in that place for a PhD program, which is longer, or an MPH, which is 2 years, but still a significant amount of time. That would be my best advice to really look into.
Thank you. Brandon, can you also give us kind of your short answer about advice and resources to get into
Sure,
grad school?
sure. So I completely agree with 100% of what Nayeli said. The other thing I would also want to mention is a lot of these public health programs, at least the ones I have looked into, do require you to do a practicum as well. And most of the time, you will use your practicum as a springboard to get your connections. So really thinking about location is, I think, should be the number one thing on your priority, on top of looking at which specialization you want to do. Because I know at University of Hawaii at Manoa, we have a Native Hawaiian and Indigenous Health specialization, which is not found much anywhere else. So if you want to have some type of specialization that's maybe not found somewhere, maybe check to see if there's like some type of faculty that can connect you places.
I love that. Can you just briefly tell our participants about what a practicum might entail?
Sure. So at least at the University of Hawaii at Manoa, my practicum was 240 hours at a site, and you basically pick a site, which we had help. Thankfully, my year we had some help where you gave their interest and they matched you to a potential site where your practicum supervisor, or I forget the official name, I just call it practicum supervisor, has to have a master's degree and above, and they have to be willing to supervise you. And from there, you basically do 240 hours, either full-time, part-time. It can be over the summer, it can be during your school year. Just have to have it done at the end of your first semester of your second year. So one semester before you graduate, because the final semester is your capstone.
Thank you. Stephanie, can you give us just your short answer about advice, resources, etc., for searching for a grad program or choosing a grad program?
Yeah, I mean, I think I pretty much have the same thoughts that they both just said. But location, I picked DC because there's so many public health organizations in this area. So, I knew from a practicum standpoint, I could definitely find something, but, afterwards it would be, easier to find a job. And again, those connections are so important. I think more so another difference, like in grad school, the people that you meet and connect with will really help you later on. So that's a huge one. Yeah, and then I picked global health epidemiology at George Washington because of how specific the program was. So you can really kind of look at the different concentrations that places have, and it really will vary quite a bit between schools. So finding something that you're really interested in was also something that I was kind of looking at too.
Awesome. Thank you. Cassidy, do
Yeah.
you also share with us?
Yeah, so to echo what everybody said, location, I like personally, I want like long term, I wanted to be in Southern California, but I wanted my experience living on the East Coast, so I was applying on both coasts. And when I got into Boston, it made the most sense. I'm like, okay, no, I'm ready for this. Let me visit, make sure I don't hate it. I didn't. I did think about staying there for a few years. Didn't work out, but and then also one of the reasons that BU stood out to me was their concentrations. At BU, you have a functional certificate, and then you can pick up additional certificates. And this like sex, sexuality, and gender, global health. You can like double. You can have two functional certificates. So I thought that was really great. Um, Also, just seeing what they're doing outside of the classroom. BU would have these public health talks uh, where the community could come and watch. It was a live stream. If you're in the Boston area, I think you could actually go on campus. And that was really my first exposure. And just seeing that BU was making something as academically complicated as public health into something a lot where a lot of people could understand. To me, like that showed impact. I know other schools might do similar types of programs, but really it's just that outside work connections. Uh, Boston is a college town. There are so many schools, so many hospitals. So that also was very appealing to me in case I did want to go into research. And scholarship also is important. BU gives good scholarships. Uh, so I know that's why a lot of people were also drawn to BU in my cohort, and just how they approach giving aid in the first place. Um, Yeah, because how the school treats a student says and prepares them says a lot about how they're going to teach you and prepare you for the real world.
Okay, so I think we're just about wrapped up because y'all are wonderful and this has been absolutely fantastic. But I just want to give you each the opportunity to give a one sentence piece of advice. I know one sentence is really hard. I understand. I see Brandon just, one sentence of advice. What is the biggest piece of advice that you could give to a current undergrad who is considering graduate school? Maybe Cassidy, we'll get you started.
Yeah, sorry for yapping. I just have a lot to say about
That's
grad
okay.
school. Now, like, don't be afraid to talk to other people about what they're doing, whether it be somebody that's in a grad program or just your peers. You learn a lot. Also, if anybody has any questions, I think my contact
Yeah,
information
yeah.
is online. Um, but yeah, definitely like talk to people, your professors. Um, One of the professors I had, she would just like tell us like what she was up to in her free time, and it was nice to see that, she has a life.
What's that? One
Yeah,
sentence. That
sorry.
was
But yeah,
perfect.
no,
No, that
that
was
was
great.
extended. But yeah, I
Thank
extended like
you.
talk to people.
Yeah, that's wonderful. Thank you. Brendan, I know that you went, ugh, when I said one sentence. Can you give us your advice?
Sure, I completely agree with Cassidy. And I would say, especially if you're thinking about a master's or even a PhD, if you're in your master's, I would talk to PhD students, just trying to get as many connections as you can. And especially since I learned in my master's, the best way to get really good recommendations or really focused recommendations is one, do good in their classes, don't act out in class. But the second thing is to meet with them extra hours and also talk about your future, because how are they going to be able to write a good recommendation for you if they don't even know what you want to do in the future? So I think that is very important.
Thank you. Natalie, best advice.
Best advice. Sorry, what was the question?
If you can give us one sentence of your best advice for current undergrad students who are considering grad school.
Yeah, go for it. But also imposter syndrome is real. Everybody goes through it, and you will get through it. You just have to go through it.
That is exceptional advice, and I don't actually know if I've ever heard that in one
Yeah.
of these panels before. So I'm so glad you said that.
Everybody goes through it, and if they're lying, if they tell you they're not, they're lying because everybody goes through it. So you will survive.
Thank you. And then Stephanie, if you can close us out with your best piece of advice.
Sure. I think where you are now, try to get hands-on experience. I think it'll prepare you to know for sure that you want to go to grad school, and also kind of give you a leg up when you're there about, getting involved and getting a job and even getting into grad school itself.
Excellent. Well, I just have to say thank you so much for all of our panelists. I know that it is late in the evening and that it is the week after Thanksgiving. So we have a very small group of participants tonight, but we have several who are giving thanks in the chat. And to all of our participants who are here or who watch this later, we will have the panelist information on our website. And there will be the ability to contact them via LinkedIn or email, etc. So panelists, you may be getting some messages from students, which is always super helpful for them to be able to connect with you. Again, I just want to give you thank you so much, give you props for coming out on a Tuesday evening so late in the day. We really, really appreciate all your participation and support. And I hope you have a wonderful night. Thanks so much.